Welcome. We would like to share with you some information about electroretinography use in a veterinary practice. We know that ERG has been perceived as difficult and time-consuming in the past. LKC Technologies developed the RETevet to address these issues. Our video starts with Professor Ron Ofri from Hebrew University of Jerusalem, Koret School of Veterinary Medicine. Professor Ofri has been teaching generations of veterinary ophthalmologists and is the author of more than 100 publications. This includes being co-author of Slatter's Fundamentals of Veterinary Ophthalmology, a book we are sure you all know well. Professor Ofri will talk about the basics of ERG and its importance for veterinary practices. We are also happy to include in this video feedback from two RETevet users. First, Anne-Marie Verbruggen from Belgium. Dr. Verbruggen is the current president of the European College of Veterinary Ophthalmologists and the owner of the Eyes Animal Ophthalmology Clinic in the Netherlands. Second, Federica Maggio from the US. Dr. Maggio is a clinical assistant professor at Tufts Cummings School of Veterinary Medicine. Dr. Maggio is also a practicing ophthalmologist at the Tufts Veterinary Emergency Treatment and Specialties Center in Massachusetts. At the end of the video, Dr. Guo He from Shanghai, China, recorded a test to show how easy it is to perform a RETevet dark and light adapted test on a non-sedated animal. Please feel free to contact your local LKC representative if you'd like to receive more information on the RETevet. If you are located in Europe or Asia, please see the information about our upcoming ERG courses in Germany and China.
Hello, everyone. My name is Ron Ofri. I am a professor of veterinary ophthalmology at the Hebrew University of Jerusalem in Israel. And I've been asked to talk to you today about why ERG is crucial in your veterinary practice. By the way, this is what an ERG recording looks like nowadays in the age of the corona pandemic. And I take the opportunity to wish all of you and all of humanity best of health, and may we overcome this epidemic in the very near future. Of course, this is just a brief introduction to an ERG. If you want to know more about it, I take the opportunity to invite you to a couple of upcoming courses I'll be teaching this summer. First one will take place in August in Frankfurt, Germany, courtesy of Eckemeyer. And on the 14th and 15th of December, we'll be doing another course in Nanjing, China, courtesy of Glowtree, LKC, and CSAVS. So as I said, I'm going to talk about why ERG is crucial to your veterinary ophthalmology practice. And I think it is fair to say that most veterinary ophthalmologists will record an ERG for one of two reasons. The first one is preoperative screening or evaluation of cataract patients. Here we have a patient with a very advanced cataract. Obviously, this patient should go into surgery. However, we have no way of examining the patient's retina. We do not know whether it is normal or atrophied. Obviously, if the patient's retina looks something like this, there is no point in going into surgery because surgery will not restore vision to the patient. And really, the only way to determine whether or not this patient has a normal functioning retina, seeing that we cannot do an ophthalmic examination in this patient, is by an ERG recording. In fact, my teacher at the University of Florida, where I trained in veterinary ophthalmology for 4 years, used to say that doing cataract surgery without preoperative ERG recording is malpractice. You really must do an ERG recording prior to surgery because there is no justification for taking the patient into such a complex and expensive surgery if you have not determined whether or not the retina is functioning. Doing a preoperative ultrasound is not enough because it tells you whether the retina is in place or not, but it doesn't tell you whether it's functional or not. Testing pupillary light reflexes is not enough because not too much afferent input is required to generate a PLR. So maybe the retina is in advanced stages of degeneration and you still have PLR present. you really must record an ERG. Here we are recording an ERG in a lemur from the local zoo. She is 20 years old and recently developed cataracts. We did an ERG recording, as you can see here in the picture. The recording demonstrated that it has a normal functioning retina. We did surgery, restored vision. Lemurs have a life expectancy of 30 years, so hopefully she'll be able to see for another 10 years for the rest of her life. The second reason that we commonly record ERG in veterinary ophthalmology practice is for workup of patients with amaurosis or a normal-looking retina. That would help us differentiate between cases that are blinded by cortical disease or retinal disease with a normal-looking retina. The classic example is differentiating between patients with SARS, sudden acquired retinal degeneration syndrome, and patients with distal optic neuritis. Here is a patient with optic neuritis, and I think that no one needs an ERG to reach a diagnosis in this case. The signs of inflammation are obvious. However, here we have a patient with a normal-looking fundus, and the fundus is normal-looking because this patient is suffering from distal optic neuritis, inflammation involving the more distal part of the optic nerve. Therefore, the fundus looks normal. Nonetheless, the patient did present with acute blindness, fixed dilated pupil, and as you can see here, a normal-looking fundus. And the problem is that a SARS patient will have an identical presentation: acute blindness, fixed dilated pupil, and a normal-looking fundus. And the only way really to reach a diagnosis and differentiate between these two diseases is through an ERG recording. Now, I imagine that many of you are saying at this stage, geez, I don't need an ERG recording to confirm a diagnosis of optic neuritis. I can do a chromatic PLR testing. Well, I'd like to draw your attention to this paper published in 2017 by my colleagues from North Carolina State University, looking at 96 cases of canine optic neuritis. Patients underwent workup that included complete blood count, biochemistry, urinalysis. Some underwent serology for infectious agents, imaging, CSF, cytology, fluorescein angiography, and of course, ERG. None of the 96 patients underwent chromatic PLR testing. So at least as far as the folks in North Carolina State University are concerned, and you can see some very distinguished ophthalmologists as co-authors on this paper, they feel that a diagnosis cannot be based on chromatic PLR testing. And here is another paper published in 2008 by Keith Montgomery, looking at 140 dogs with acute blindness. These included 120 dogs with SARS and 20 dogs with neurological disease, which in this case was optic neuritis. And the conclusion of Keith Montgomery in this paper was that an ERG is needed to rule out neurological disease or optic neuritis in cases of amaurosis. Basically, if you have optic neuritis, you'll have a normal retinal function, such as the recording you can see here. If you have SARS, then you'll have a flat ERG, the recording you can see here. I don't think you need to attend the course in order to appreciate the difference between these two eyes. So these are really the most common indications for ERG in veterinary ophthalmology practice: workup of patients with cataract prior to surgery, and workup of blind patients presenting with amaurosis. However, there are other indications for recording, and I've published several papers on the subject. The first would be to work up patients with progressive retinal atrophy, so-called PRA or PRCD. Here we publish a paper looking at progressive retinal degeneration in Bengal cats, and we used the ERG to record the progression of the disease in these cats. Day blindness is another disease with amaurosis. Patients present with a normal-looking fundus, and the only way to confirm a diagnosis of day blindness is through ERG recording of cone function, and this is what we did in this paper, diagnosing day blindness in a herd of sheep. And finally, a paper we published in 2018 looking at ERG as a prognostic indicator for dogs undergoing retinal reattachment surgery. So if you have a patient with retinal detachment, then you could use your ERG recording to determine the prognosis prior to referring the patient to surgery by a vitreoretinal surgeon. So these are some of the uses of ERG. If you want to find out more, once again, I take the opportunity to invite you to the upcoming courses where we shall be discussing the origin of the ERG, so a brief review of retinal anatomy and physiology. We'll talk about how to distinguish between rod and cone responses, which allows you to work up patients with progressive retinal atrophy. We'll be talking about how to record an ERG, how to prepare your patient, the equipment, and the protocols you'd be using. Here is a handy tip for you. When recording ERG in the dark, you can see that I'm using a headband with a red headlight that allows me to keep both hands free as I am recording a patient in the darkness. We'll be talking about problem solving and troubleshooting, which involves mainly how to overcome noise and other technical problems. We'll be talking about other ERG modalities, their benefits and limitations. We'll discuss clinical cases and how to interpret your recording. And in both courses, we shall be conducting a wet lab recording ERGs from canine patients. So once again, I'd like to invite you to one of the two upcoming courses in Germany in August or in Nanjing in December, hoping to see you in one of the two locations. Thank you very much.
Hello, my name is Anne-Marie Verbruggen. I'm a specialist ophthalmologist, diplomat of the European College of Veterinary Ophthalmologists. I'm the owner of Eyes Eye Clinic in Breda, the Netherlands. My special interests in ophthalmology are hereditary eye diseases screening and diseases and surgery of the anterior segment, cornea and eyelids. I must admit that the electrophysiology of the retina has never been my forte. I've left all the ERG exams to my colleague who's also performing the cataract surgeries. For me, the ERG exam was too many fine-tuning and background noises that you had to cancel and all these sedations, and I didn't have the patience to do that. I was fortunate to have the possibility to test out a new device, the RETevet. I was also very lucky to get some professional advice and backup from LKC. I was positively surprised at how fast the exam could be performed and well tolerated by the patient. So far, I only had to sedate one crazy French bulldog puppy. It is also very nice to have the owner with you in the room while you're doing the exam, so they can see what you are doing, they understand what you are doing, and they are more understanding also of the results because they can see it directly on the screen after the examination. Using the RETevet has triggered my interest in the electrophysiology of the retina again, and I'm very keen to open books again, and maybe also, if the actual situations allow it, to go to the seminar that is going to be given by Ron Ofri in August this year together with Eichenmeier. I thank you.
Hi, my name is Federica Maggio, and I'm the ophthalmology specialist at Tufts Vets. a veterinary specialty hospital located southwest of Boston in Valpole, Massachusetts. During my regular work schedule, I see patients 3 days a week and perform surgeries twice weekly. A prominent part of my surgical appointments is represented by cataract surgeries in dogs. And in that context, pre-surgical screening by electroretinography plays a critical role. I first heard of RETevet from some of my colleagues who were very happy with it and told me of how easy it was to use. And since I found myself in need of replacing my old ERG machine, I contacted LKC Technologies and purchased a RETevet unit. My experience with RETevet has been great. I am actually quite impressed by how straightforward and supple this device is. I mainly use it for pre-surgical screening of cataract cases, but I also use it for the diagnosis of retinal disorders, for example, sudden acquired retinal degeneration syndromes and progressive retinal atrophies. There are several features that make this device appealing. We can start with the fact that you don't need a laptop or a computer in general to operate it. It's a simple handheld device, quite light, and that you can easily hold in front of the animal's eye during the test. I also love that it comes with a mini Gansfeld bowl with a very, very soft eye cup that shields the eye comfortably, especially for the patient. An additional ingenious feature is that the device includes a real-time camera that allows you to monitor the patient's pupils during the testing. In this fashion, the device is perfectly placed in terms of distance over the patient's eye at all times. I must confess that I am a technology junkie, so for me, one of the top perks of this machine is not only the ease of data recording, but especially the ease of data downloading into my digital medical records software. It is a quite seamless process, easy, very quick, so that the PDFs of the ERG's tests I have recorded are permanently included in my patient's medical record. LKC Technologies has been extremely receptive to my professional needs. They are very quick to respond in terms of software updates and improvements, especially regarding the ERG protocols. They will work with you if you have special requests in regard to protocols tweaking, or if you wish for a different protocol entirely. In short, my experience with RETevet is extremely positive, and I would recommend it to every colleague working in a clinical setting like me.
I'm Gaohui from Shanghai Phyllis Pet Ophthalmology Clinic. Today, I will present a light adaptation test. I have done the dilation for this dog 20 minutes before. We can do the topical anesthesia 5 minutes before the test. Now we turn on the device. Select the protocol. Cone function testing. Then select New Test and enter the animal's ID. Place electrode on him. Red one is the active corneal electrode. This green one is ground electrode. Black one is reference electrode. I suggest to align RETevet as close to the eye as possible. We can remove the ring. Let's start test, and we need to see the ERG jet is always at the center of the pupil, and we can see this through the circle from the screen. Follow the command on screen to continue the test. Now, move to test the left eye and repeat the same steps. After we finish the test, the most important thing is you must wait the date to be saved to finish the protocol. Then we can either see the result from the screen or from your computer. The report shows the dog has good cone function